Let's talk about the anatomy of the anterior aspect of our leg, starting with the skeletal structures. First, we have the pelvis. And then inside the pelvis, we have a couple of landmarks. The anterior superior iliac spine. These are these structures right here. And then the curve directly underneath the anterior superior iliac spine is the anterior inferior iliac spine. So that's going to be A and B. Then we have the pubic arch, which is going to be this area right here, C. Then working our way down, we have the great trochanter of the femur. So that's going to be number 2, the femur. Then we have our patella, our kneecap. Then just below it, we have the two bones of the lower leg, the tibia, number 4, and the fibula, number 5. Okay, so now that we've covered the basic skeletal structure, let's talk about the anatomical landmarks. Okay, running a little bit above the bumps here of the anterior superior iliac spine, and then running across the hips, we have our anterior iliac crest. That's going to be number 1. Then there's a second fold running beneath the bumps of the anterior superior iliac spine. That's going to be the pubic fold right here. And then just below it, you have the actual groin. Below that, we have our great trochanter of the femur. That's going to be right here. We already talked about it. Then we have the surface of the sartorius, which is a separation between the quadriceps group and the adductor group. So more on that when we talk about the musculature. That's going to be an important landmark running across this way, the separation between these two big muscle groups. That's going to be number 4, the surface of the sartorius. Then number 5, we have our patella. Then just below the patella, we have a round shape which is called the fatty pad. There's no Latin name for it as far as I can tell. It's simply called the fatty pad. And then just below it, we have a bump, which is called the anterior tuberosity of the tibia. So number 6 is the fatty pad, and the anterior tuberosity of the tibia is going to be number 7. Then lined up with the anterior tuberosity, we have a little bump, which is the head of the fibula, number 8. And then working our way down towards the ankles, we have an ankle bone on the inside called the medial malleolus, and ankle bone on the outside, which is the lateral malleolus. All right, now that we've covered the landmarks, let's talk about our muscle groups. Let's change colors again. Let's start off with a darker red. Okay, the adductor group. There's a series of muscles there. We have the adductor magnus, adductors longus, and brevis, but all of them start at the pubic bone here, and then run all the way along the inside of the femur right here, the adductor group. So that's going to be A. Then also running from the pubic bone right here, and then running straight down the leg. Let's change colors a little bit. We have our gracilis muscle. So gracilis attaches to the medial epicondyle of the femur, our gracilis muscle. That's going to be B. And then on the opposite side, we have our quadriceps femoris. So quad means 4. There's 4 distinct muscles. Let's talk about them. The Vastus Medialis starts at the very, very top of the femur and runs along the inside of the bone, then turns into a tendon that attaches to the patella. That's going to be your Vastus Medialis muscle, number 1. Here. Then we have another muscle on the opposite side, which also starts at the trochanter, let's change colors just a little tiny bit so we can make a distinction here. Runs all the way along the outside of the femur. Again, turns into tendon, which attaches to the kneecap, the patella, running this way. So that's going to be 2. So Vastus Medialis on the inside, Vastus Lateralis on the outside. Then on top of this, let's see if we can introduce a layer here. And let's change colors. Let's go a little bit brighter. We have a muscle called the Rectus Femoris, which starts all the way up here in the anterior inferior iliac spine, and then runs straight down and attaches to the kneecap. So we go a little bit brighter here. So rectus femoris. Rectus means straight. This muscle runs straight down the leg this way. The rectus femoris muscle, that's going to be number 3. And then we have the last muscle, which is the vastus intermedius. That's a very small muscle. It runs in the lower third of the femur. So if we can make all of this disappear, let's see if we can get this to disappear. Okay, let's get this to disappear as well. Vastus intermedius starts here and then wraps around this way. So this is a muscle that is barely visible from the front, actually barely visible from the outside aspect as well, unless it's tensed, usually when a person's about to sit down. We have our vastus intermedius. That's going to be number 4. Okay, so let's get all these to reappear again. Those are the muscles of the quadriceps. Okay, so on top of this, we have 2 other muscles that sit, or let's say start in the hip and then work their way down towards the bottom of the leg, or the kneecap. Let's add a layer here. Okay, and let's use white. Both these muscles originate at the tip of our anterior superior iliac spine. On the inside, we have a muscle that divides, that separates our quadriceps from our adductors. That is the Sartorius muscle. This is the longest muscle in the human body. It's also called the talar muscle. It runs all the way between your quadriceps and your adductors, then wraps behind the medial condyle of the femur, and then reappears again as a tendon attaching itself to the anterior tuberosity of the tibia, your Sartorius muscle. You can sometimes see this muscle when the leg is really tensed or trying to rotate inward, but mostly it's visible as a depression, your Sartorius muscle. That's going to be D. And then on the opposite side, we have another muscle that bulges only up to the point of the trochanter, and then at the trochanter, where it attaches, it turns into tendon that runs all the way along the inside of the leg and attaches itself to the lateral epicondyle of the tibia right here. It's one of the straps, one of the insertion points that you're going to see from the side of the leg. That's the tensor fasciae latae. Okay, now let's talk about the muscles of the lower leg, of the shin. We have a muscle, let's see if we can add a layer here. Okay, that's good. Let's go back to darker red. That starts on the lateral condyle of the tibia. Is muscle tissue in the upper part of the shin, and after the lower part, at the halfway point, it starts turning into tendon, runs to the middle of the ankle, and then starts fanning out to the 4 smaller toes, like this. That's going to be your extensor digitorum longus, F. Then on top of this, we have our tibialis anterior, which, let's change levels here again, Let's change colors. Let's go a little bit brighter. Starts a little bit closer to the inside of the lateral epicondyle, so just off to the side. Overlaps the extensor digitorum longus, running this way. Turns to the tendon in the lower half, and then that tendon starts wrapping around to behind the ball of the big toe. The extensor digitorum, your tibialis anterior. So that muscle runs this way, like this. And then we have a third muscle, your extensor hallucis, it says hallucinate here, hallucis, hallucis longus. That's the auto spelling correct that did that. Let's see, let's change levels here. Let's change colors. Your extensor hallucis longus, which starts in the lower half of the shin and then runs perfectly straight and attaches itself to the first knuckle of your toe, your big toe. Extensor hallucis longus. What else are you seeing? Well, we have a muscle that runs starting from, let's use a different color here, from the head of your fibula, running all the way along the side this way, then wrapping around the lateral malleolus and attaching itself to the sole of the foot. That is our Peroneus longus muscle. Running that way. And then the muscles that we're seeing in the contours are muscles that we're going to talk about when we talk about the back of the leg. We have the calf muscle here on both sides. We have the soleus muscle. So the main thing to remember about the lower part of the leg is that all of the muscles bulge in the upper half towards the lateral side, leaving the medial side more or less exposed. Right? There's nothing but bone on this side. So here what we're seeing is the surface of the tibia. Okay, so that covers in a general way the muscles, the landmarks, the skeletal structure of the leg from the front. Now let's talk about the leg from the posterior aspect. Let's start with our anatomical landmarks, as always. We have our posterior superior iliac crest, which are these shapes here. Then in between them, we have the triangular shape of the sacrum. That's going to be number 2. The sacrum runs to about the halfway point on the hip. Below the halfway point, we have our gluteal fold, which is right about here. And we have the great trochanter, which we already talked about. That's going to be number 4. These little circular shapes right here are called the ischium. That's going to be number 5. Then working our way down, we have the medial and lateral condyles of the femur. So the medial means on the inside. So here's the medial, and here is the lateral. Then we have the medial and lateral condyles, excuse me for the spelling, condyles of the tibia. That's going to be here and here. Then working our way down again, we have the Achilles tendon, which is a tendon that separates the bones of the leg with the heel bone, the bones of the foot. So we have the Achilles tendon, the tendon calcaneus. It's going to be number 8, and then the calcaneus itself, the bone of the heel, is going to be number 9. Okay, so that covers the anatomical landmarks. Now let's talk about our muscles. Let's start off with our biceps femoris muscle, which runs from the ischium to the lateral condyle of the tibia. Now there's 2 muscles there. We've got the long head and the short head, but you might as well consider them one single long muscle that runs like this. You've got your biceps femoris. On the opposite side, also starting from the ischium, let's change colors a little bit. We have a muscle that starts at the ischium and then runs to the medial condyle. See if we can change the color a little more. There we go. You guys can see the difference here. So that's going to be your semimembranosus and semitendinosus muscle. The tendinosus muscle runs higher, and on the inside, semimembranosus runs a little bit lower, bulges a little bit lower, and is the more surface muscle, the semimembranosus. Okay, now let's talk about the soleus. The soleus starts at the lateral condyle of the tibia, starts bulging all the way along the length of the tibia this way, then turns into tendon, and that tendon attaches itself to the calcaneus, your soleus muscle. And then sitting on top, let's move that on top, we have the gastrocnemius muscle. These are your calf muscles. There's a medial head, there's a lateral head. Let's use a different color here. Those muscles originate in the medial and lateral condyles of the femur. So they're going to start, hopefully you guys can see this, underneath the semimembranosus tendinosus and biceps femoris. They attach themselves to the soleus at about the halfway point on the tibia. So we have one muscle that runs this way, like this, and then the medial head starts at the medial condyle of the femur, bulges this way. So let's use something to separate the two. There we go, like that. So that's going to be your gastrocnemius muscles, H, the lateral, and H, the medial. Okay, what else are you seeing? Well, the contours on the inside of the leg and the outside of the leg are formed by muscles that are visible from the front. So let's do this. Let's use a really dark red here. On the inside, we have our adductors here, and then we see a little bit of the Vastus Medialis on this side here. So the adductor group is going to be I, Vastus Medialis is going to be K, and then on the outside, we have your Vastus Lateralis. So the contours from the back are created by muscles that are also visible from the front. Okay, what else do we need to cover? Look, I think that covers the muscles from the back, with the exception of the Gluteus Medius and Gluteus Maximus. So let's see if we can talk about those really quickly. Right, the Gluteus Medius runs all the way along the posterior iliac crest and attaches itself to the trochanter, like this. That's going to be the Gluteus Medius, like this. And then we have the Gluteus Maximus. Let's change colors. Gluteus Maximus starts all the way along the sacrum, and then half of it inserts at the trochanter, right about here, like this. And then there's another portion which runs along the ischium and attaches itself to the tendon of the tensor fasciae latae. So this actually needs to be all the way on top, so it looks like it's sitting in front. And it obviously creates our gluteal fold. Okay, so that covers the anatomy of the leg from the posterior aspect. Now let's talk about the lateral aspect, the side angle of the leg. All right, let's get our anatomical landmarks out of the way. We've got our iliac crest, which is going to run all the way here, like this. We have our sacrum, which is the bony plate right here. That's going to be number 2. We have the trochanter. Here's the trochanter, number 3. Our patella, number 4. We have the fatty pad underneath the patella. That's going to be this area right here. And then the anterior tuberosity of the tibia. That's going to be this little bump right here, like this. And then working our way down, we have the lateral malleolus, which is formed by the fibula, number 7. And then lastly, our calcaneus. Okay, now let's talk about our muscles. Okay, let's start with the biceps femoris. This is a muscle that originates at the ischium, runs straight down to the lateral condyle of the tibia, your biceps femoris. It's going to be number 1. And then on the opposite side, starting at the trochanter right here, then running to the patella, we have our vastus, let's change colors here, our vastus lateralis. So vastus lateralis occupies probably about 2/3 of the surface area of the leg on the outside. Most of what you're seeing from the side here. Really big muscle. That's going to be number 2, our vastus lateralis. Then we're going to see a little bit of the rectus femoris as well. Let's change colors here. So the rectus femoris starts at the anterior inferior iliac crest. That's going to be right here. And is going to run straight down to the patellar tendon. That's going to be your rectus femoris muscle. Number 3. Okay, now we've got our gluteus medius and gluteus maximus. Let's see if we can add a layer here. Okay. Our gluteus medius runs all the way along the length of the iliac crest and attaches to the trochanter. So that's going to look like this. And then our gluteus maximus runs all the way along the length of the sacrum here and attaches also to the trochanter this way. Like this. But another part of it attaches to the tensor fasciae latae, which we're going to talk about in just 1 second. So here is our gluteus medius, number 4, and our gluteus maximus, number 5. And then the tensor fasciae latae, let's put this in a different layer here. Okay. Let's change colors. Is a muscle that originates at the tip of the superior anterior iliac crest, and then past the trochanter, stops bulging and turns into tendon, which attaches itself to the gluteus medius. So these are muscles that will connect, then turn into tissue. It's going to run straight down the length of the side of the leg and attach itself to the lateral condyle of the tibia towards the front, this way. So when you're looking at the knee from this side view, you can look for 3 distinct straps. The first strap, let's just change colors here so you guys can see this. The first strap is formed by the biceps femoris. The middle strap is formed by the tensor fasciae latae, and then we have another strap which is formed by the patellar ligament. So we've got 1, 2, 3 straps, 3 separations you should be looking for when you're looking at the knee from the side. Okay, what else are you seeing? Well, we're seeing a little bit of the semi-tendinosus, semi-membranosus muscles here. So maybe this bulge here is created by the semi-membranosus, semi-tendinosus muscles. But mostly we're seeing muscles we're seeing the Vastus Lateralis and the biceps femoris from the side. Okay, now let's work our way down. Let's talk about the muscles of the shin. We have our Extensor Digitorum Longus, which starts at the lateral condyle. Let's change levels here. So it's going to start here, work itself along the length of the tibia, then turns to the tendon, and then fans out to the 4 toes, this way. Then on top, we have our Tibialis Anterior. Change colors even more. Tibialis Anterior, running this way. So number 7, and Tibialis Anterior is number 8, this way. Then on the other side, we have our Soleus Muscle and our Gastrocnemius Muscle. So our soleus starts at the lateral condyle of the tibia and runs all the way along the length of the tibia, this way. That's our soleus muscle. And then on top, we have our gastrocnemius muscle. Let's change levels here. Change colors. The gastrocnemius starts at the lateral and medial condyle of the femur, so it's going to start wrapping here. And we have the lateral head here, like this. The gastrocnemius, that's going to be number 10. What else are we seeing? Well, we're seeing the Peroneus longus muscle. That muscle originates at the head of the fibula, right here. Let's change levels. And let's change colors. Starts here, runs all the way along the length of the fibula, this way. Then turns into a little tendon here, wraps underneath the lateral malleolus, the outside ankle bone, and attaches right about here on the foot. Your Peroneus longus muscle. Okay, that covers the landmarks and muscle groups of the leg from the side. Now let's talk about what happens on the inside of the leg. Okay, since we've talked about the anatomical landmarks from other angles, and they're the same here, let's go directly into our muscle groups. Let's add a few more layers. Okay, so let's start off with our adductor group, which is going to start at the pubic bone and run all the way along the length of the femur, running this way. Our adductor group, so that's going to be number 1 here, like this. Okay, let's skip the gracilis for a second, and let's go directly into the vastus medialis. So that's going to be a muscle that starts from the trochanter that's behind the hips here, like this. Let's change colors. And then runs all the way to the patellar tendon here, like this. Actually, excuse me, the patellar ligament. So we're going to see a little bit of the vastus medialis coming here, like this. So that's going to be number 3, our Vastus Medialis. And then on top, you're going to see the Rectus Femoris. Change colors again. Let's go a little brighter. We're going to see the Rectus Femoris sitting on top of the Vastus Medialis, and then also attaching to our patellar ligament. Running this way, like that. Okay, well, what are we seeing in the back? We have our 2 semi-muscles, semitendinosus, semimembranosus. So that's going to be muscles that run, let's go back to our red here. They run from the ischium straight down the back of the leg and attach to our medial condyle of the tibia right here. So that's going to be the semitendinosus and the semimembranosus muscle. So that'll be our 5 and 6. 5 and 6. Okay, now let's work our way down to the soleus and the gastrocnemius. Let's add a layer here. And let's go a little bit darker with the soleus. So the soleus starts on the lateral condyle, so it starts on the outside here. It's going to bulge all the way along the length of the tibia here, like this. Turning into the Achilles tendon and attaching itself to the calcaneus, the heel bone. So we've got our soleus here. That's going to be number 7. And then sitting on top, we have the gastrocnemius. Let's work a little brighter here. So gastrocnemius starts at the condyles of the femur. So it's going to start here. In fact, this needs to sit on top like this. So here's the gastrocnemius, like this. So we're seeing the medial head here of the gastrocnemius. Okay, let's see if we can move this up a little bit. Okay, gastrocnemius. So that's going to be number 8. And then we have a few muscles on the front of the shin, mainly our tibialis anterior. You might be able to see a little bit of the extensor digitorum. It's possible, but mostly probably tibialis anterior here. So that's going to be number 9, like this. And then we've got 2 more muscles, the gracilis and the sartorius. Let's add another layer here, and let's work in white so we can see this as clearly as possible. All right, so the gracilis muscle starts at the pubic bone and is going to run straight down like this. Let's get white in there. Here's our gracilis muscle running from the pubic arch and attaching itself to the medial condyle here. We've got the gracilis here, like this. That's going to be number 2. Sorry, this is a little bit out of order. And then the soleus, the sartorius, number 10. So what should we do? Let's stay with that same color. So sartorius starts at the iliac crest, the tip of the iliac crest, and divides our 2 main muscle groups, our quadriceps here and our adductor group. So our sartorius is going to run, let's change colors entirely. Let's do this. He's going to run in between here. It's going to run behind the condyle of the tibia, of the femur, Let's put this all the way on top. There we go. Then runs underneath the condyle of the femur and attaches to the anterior tuberosity. So there is our sartorius muscle, number 10. Okay, that I believe covers roughly just about everything you need. Now it's time for you guys to get out your charts get out your poses and see what this looks like in practice.